In this narrated presentation, we're going to go beyond the definitions and conceptual understanding of behavioral and mental health disorders and start looking at how they are treated. Treatment of behavioral health issues can be categorized into several different modalities. For each one, there are interventions that are appropriate at a community health worker level and others that are more suited for behavioral health clinicians. So let's take a look at each one. For behavioral interventions, community health workers can be effective at brief intervention and informal counseling for the purposes of identifying risk factors, working through barriers, and supporting positive behavior change. Formal counseling, including rehabilitation and diagnosis of behavioral health disorders, is beyond the scope of a community health worker. For cognitive, community health workers can be effective at administering cognitive screening forms in the field for hard-to-reach clients and encouraging engagement in mental health treatment. Interpreting the results of such screenings or providing recommendations on treatment is beyond the scope of a community health worker. For cognitive behavioral interventions, cognitive behavioral therapy, or CBT, is an evidence-based behavioral health disorder treatment modality used by social workers and therapists. It requires specific training, understanding of related concepts, and the organizational resources to support longitudinal care relationships with clients. Due to the higher level practice liabilities involved, it is beyond the scope of a community health worker. For integrative and mindfulness-based, community health workers can really shine when helping clients promote their own internal and external resources. The unique capacities of the community health worker role allows for more time devoted to activities centered around mindfulness, grounding, and navigating clients through health and wellness systems. The person-centered and culturally responsive practice of community health workers is exceptional in respect to this kind of treatment for behavioral health issues. Efforts to further synthesize physical and behavioral health care have resulted in the creation of integrated behavioral health care systems. Integrated behavioral health care is defined as integrating behavioral health, so mental health and substance use services, into a primary care system. It involves changes across the organization's workforce, administration, clinical operations, and more to be able to support both treatment methods. Encompasses management, delivery of healthcare services, so individuals receive a continuum of preventative and restorative mental health and addiction services according to their needs over time across different levels of the healthcare system, truly matching what integrated is meant to represent. In the following slides, we'll be going into detail on the 4 stages of treatment and integrated care: engagement, persuasion, active treatment, and relapse prevention. Engagement means encouraging a professional, patient-centered relationship conducive to promoting positive behavior change. It includes using skills such as the stages of change, motivational interviewing, demonstrating warmth, genuineness, and empathy, cultural competence and humility, and co-produced care. We'll be going into more detail on these skills later in the training. Persuasion is the further use of motivational interviewing. The ORS method of motivational interviewing means asking open-ended questions, allowing for a richer, deeper conversation that flows and builds empathy, providing affirmations used to recognize clients' strengths, successes, and efforts to change. An example would be, you showing up for your appointment after having such a difficult weekend is admirable. Reflective listening, the primary way of responding to clients and building empathy, which involves listening carefully to clients and then making a reasonable guess about what they are saying. So reflecting back in a way of saying, what I hear you saying is, and then summaries, relating or linking what clients have already expressed and requires that the practitioner pays close attention to what the client has said. Sometimes helpful in transitioning a talkative client from one topic to the next if time is limited. In active treatment, community health workers do not engage in sustained therapy. However, psychologists have found that we can all learn and show how to improve our coping skills and be more resilient. Ways community health workers can help their clients with these topics include, for problem solving, you can help empower clients by guiding them to the solutions to problems instead of just trying to solve the issues for them. This will really improve your client's confidence because they take ownership over that choice. For breathing, Try breathing exercises with your clients to help them be present in the moment. It can be as simple as 3 deep breaths, just enough to center them in the room. For distraction, it can be good to take a break from all the focus on one's issues. It can be just as valuable to work with someone on a way to find an outlet for stress as it is to try to fix the cause of the stress, especially if that cause is something the client has little or no control over. For sensations, being aware of objects around you and the sensation they bring, whether it's a soft pillow, the smell of cookies baking, a warm blanket, is an essential tool for grounding, a method of encouraging comfort and the de-escalation of symptoms associated with stress and anxiety. For self-soothing, you'll find that many people put the priorities of others over themselves, which can end up being harmful. So it's important to encourage clients to prioritize their own peace of mind as well as those around them. For mindfulness, many clients you work with will come to you overwhelmed by everything going on in their lives that they need support with. Helping break down the swirling cloud of confusion and anxiety into actionable steps and tasks makes a huge impact on reducing that feeling of being overwhelmed. Further organizing that list of actions into smaller, one thing at a time chunks turns mountains back into molehills. For imagery, as with sensations, the more we take the time to fully experience life with all of our senses, the more grounded we are. Creating the image in your head of how you picture yourself with fulfillment and happiness will lead to positive thoughts. Then those positive thoughts will lead to positive actions. Those positive actions will lead to a positive feeling, and so on. In empathy, connecting with people on an emotional level and sharing an appropriate amount of vulnerability helps to form supportive relationships. Just be aware of setting boundaries with your clients as well to keep both them and yourself safe. We'll go into further detail about that later on in the training. The final treatment stage in integrated care is relapse prevention and recovery. Recovery is based on the idea that individuals with serious mental illness can and do recover and live productive and meaningful lives in the community, just like anyone with an illness that may flare up from time to time. A recovery-oriented framework is one which is driven by the person with the illness and one which operates from a belief shared by the mental health team and actively communicated to the person that recovery can occur and should be expected. We'll go